Okay, so today we're going to be looking at the characteristics of a phobia. First off, let's make sure we understand what a phobia is. It's an irrational fear of an object or situation. Irrational is the key word here, okay? There's not a real reason to actually be afraid of whatever it is that you're afraid of. It is totally irrational. And we have very rational fears, things that we should be afraid of. For example, being in the room with a big tiger. But being in a room with a tiny weeny house spider, there's nothing to be afraid of, but lots of people do have fears of spiders. So what Spec says? Spec says that behavioural, emotional and cognitive characteristics of phobia is what we need to know, and we're going to be looking at those today. So before we go on, with all of the disorders we're looking at, OCD and depression and phobia, they're all diagnosed using the Diagnostic Statistical Manual of Mental Disorder, which is the DSM system. And a psychiatrist and a doctor will use this to decide and give a person a diagnosis of a particular mental disorder. And this is so that diagnosing and categorising of mental disorder is maintained and it's valid. So let's have a look at phobia. So the diagnostic features of phobia are they are a marked or persistent fear that is excessive or unreasonable, cued by a specific object or situation. Any exposure to that phobic stimulus provokes an immediate anxiety response. The person, however, does realise the fear is excessive or unreasonable, but this doesn't happen in children. Children aren't able to see that the fear is excessive because of how their mind is developed at that stage. The phobic situation is avoided or endured with intense distress. So, you wouldn't go, I was afraid of birds, so I wouldn't go into a room with the birds or hold a bird. Or if I have to be there, I would stay very still, focused on the bird, but also be feeling very, very distressed internally. A phobia interferes with a person's functioning if under 18 years old and the duration is more than 6 months. So that is the actual criteria in the DSM. It also states there's different types of phobia. And they are specific phobias. So that's of an animal or an event, bodily object like blood. I actually had a friend who was afraid of hair. All situations in enclosed spaces, like going in a lift. Social phobias, so being afraid of being in social situations, public speaking, meeting new people. Again, I knew someone who was afraid of eating in public. And then lastly, agoraphobia. This is a fear of public spaces, not wanting to go out, wanting to be on their own. And generally, these people don't want to leave their own home. Okay. All phobias are common in women, or more common in women than they are actually in men, particularly agoraphobia. Social phobia tends to be more prevalent when you're a teenager, and agoraphobia as you get older. So we're going to be now looking at the behavioural characteristics, the way people act when they come into contact with something that they're afraid of. So there are 3 main behavioural characteristics. First, panic. You know if someone comes across something they're afraid of, they panic, they might stand on a chair, scream, and run away, make a very loud noise about the fact that they're really upset. Or they would avoid, so they'll make a conscious effort not to come into contact with whatever it is they're afraid of. So if they know they're going to the zoo and they're afraid of lions, they ain't going to go anywhere near the lion's enclosure, so they'll avoid it. Unfortunately, there are circumstances where we may have to endure it, whatever it is we're afraid of. And so they will just literally stand there and be stiff and very afraid, not moving, but they will still experience these horrible, unpleasant anxiety symptoms. So emotional characteristics, the way people feel. They're split into 3. People feel highly anxious. Anxiety is an unpleasant physical reaction. So this is when your heart races, you're breathing really, really quickly. You might be sweating, you'll feel sick. You probably also want to go to the toilet. It's all those feelings that you fear perhaps when you're worried about going to an exam, for example. That's anxiety. And people feel that when they come in contact with the phobic stimulus. And now fear. Fear is an immediate response. Okay, so this is when people they're screaming. They're really, 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 really afraid. It's sort of the next level up from anxiety. It's slightly different from anxiety, but it's up there with anxiety. And also, all of these emotional responses are we go beyond what is reasonably expected. So, our behaviour and our actions and our emotions are not what most people would expect us to do. So, right, lastly, cognitive characteristics. And I know that sometimes you guys find hard the cognitive characteristics, but you just have to keep remembering it's the way people think. So, people with phobias process information about phobic stimulus differently from other objects and situations. There are 3 ways. So, firstly, selective attention. Someone who's afraid of something will generally make sure they know where it is. So, if you're in a room with a spider, you want to know where that spider is in the room the whole time. Okay, and they find it very hard to look away from that feared object. They'll suffer from irrational beliefs. Okay, the beliefs they have about the feared stimulus are not rational. They make no sense. There's absolutely no reason to be afraid of a house spider. I'm sure some of you are going, yes, there is, miss, but there isn't. And they also suffer from cognitive distortions. The perception of the feared object may be distorted. Quite often when someone's phobic of something, they perceive the object to be more alien-like, not normal. And that is quite an evolutionary concept. We actually we're afraid of things which are not normal, or not normal to us. And so when we have a phobia for something that's wouldn't normally be afraid of, like, I don't know, cotton wool, and yes, there are people afraid of cotton wool, or tummy buttons, we distort them. In our head, we distort what the reality is about that object, and it makes us become afraid. Okay, that's it for today.